Well, tonight in Your Eye on Health, we are recognizing Men's Health Month, and we are taking a very close look at what screenings can help during certain ages for men. So joining us tonight here in studio, we've got Dr. Jeremy Brown. He is a family medicine physician with Baylor Scott White. Dr. Brown, thank you so much for being with us. We appreciate it. This is an important conversation, so I'm glad we're having it here. I want to start with this. Why is it so important for men to think about their health and these screenings, specifically the screenings by decades?
Yes. So first off, thanks for having me, Ken. Happy to be here. So what's so important is that each decade kind of presents its own issues that we need to keep our eyes open for.
Okay.
And the screenings that take place, they evolve as we get older. So, preventive care is one of the best ways to kind of take care of your health long term. So making sure we kind of take advantage of the screenings and get, connected with the physician is extremely important.
Yeah. Okay, so let's go through some of these decades then. So what are we talking about as far as focusing in on when a man is somewhere between 20 and 30 in that decade?
So actually, I call that's like the building the foundation decades, right?
Okay.
So it puts a smile on my face when I have a 20-year-old come to see me for an annual exam because I know they're on top of getting on track for their health journey, right? So we talk about things like blood pressure, cholesterol, diabetes, exercise, mental health. We can't forget that.
Yeah, sure.
So those are very big in kind of those earlier decades of life. And family history, that's very important to mention too. It's important for us to know a patient's family history so we can kind of fine-tune their care, because that might cause us to have to do screening sooner.
Right. Okay. So then we move on to 40s now, right? This is the point where, jokingly, I've heard friends of mine say that's when the wheels start coming off, man.
It's so true.
We're laughing about it, but this is serious. 40s is important. What are they focusing in on at 40s? Or what do you tell your patients?
So I'm actually 43. So what I tell patients is, when we get into our 40s, we're now making up for what took place in our 20s and 30s. So those things start to catch up to us, right?
Yeah, boy, do they.
Absolutely. So we have to keep that in the back of our head. So that's why it's so important to make good decisions when we're younger. But in our 40s, prostate cancer screening, depending on risk, that's something that starts to take place in our 40s. Colon cancer, that's a big one. Sure. 45 is the magic age for colon cancer.
Really?
So
that sounds young.
It actually keeps going down as time passes because it's become more of an issue. So 45 is the age where we want to screen.
Real quick, because we got other questions, but you brought that up. What is that attributed to? I mean, the drop in that. What do you think?
I think it's multifactorial. I think it's a lot of what we're eating. I think, we talk about nature versus nurture. I think it's a lot of the nurture side of it too, So our diets are different. All those things, I think, impact that.
Well, I hate to hear it, but the good thing is that, the earlier the screening, the more you can do, right, in a situation like that, should that come up. Okay, let's talk about 50s and beyond. What happens during those years that you all need to be keeping a close eye on?
So when we get into our 50s, I kind of call that the area where we're like trying to preserve like independence, vitality, our quality of life, right? So it's kind of like building blocks. So we're still building off of what we're doing in our 20s and 30s, our 40s. Now in our 50s, we're still doing colonoscopies. We're still, 50 for most men. If there's, they're not high risk, we start doing the prostate cancer when they hit 50. And then there's a couple of vaccines that actually come into play, like shingles vaccines, pneumonia vaccines. So those are some of the things that start to come in as we get into the decade of our 50s. So,
but we've got to take care of ourselves. What advice do you give to men so that they can build a preventative care plan? I mean, how do we get there? I don't think many men, unless they come from a household really that knows all this stuff, I don't think a lot of them, at least none of my friends that I know, pay that close attention to this. But what's a good way to start this?
It's extremely important to have a primary care physician that you feel comfortable with.
Okay, yeah, number one.
And yes, number one. If you don't have one, talk to your friends about it. They might have a PCP that they really like, and hopefully you can maybe go and see them. But having that relationship is extremely important so you can feel comfortable with someone to share your health concerns. And then when you build that trust, then you might be more inclined to listen to the physician. If they say, make sure you do this screening or whatnot, you might be more inclined to take heed in their advice because we just want to help you. That's our goal. We want you to be the best version of yourself when it comes to your health.
And I think, once again, I mean, none of this is to scare anybody out there. It's just to give people a heads up that the earlier, the better, as far as detection, as far as these preventative care plans, and as far as any treatment, right? I mean, you want to give yourself time.
Oh, 100%.
and not wait for something bad to happen, right?
Absolutely.
Dr. Jeremy Brown, thank you so much. I wish we had more time because I could talk about this for forever.
Oh, of course.
I'm learning a lot about this myself.
Yes.
So thank you so much for coming in. I hope you come back soon.
Thank you so much.
All right, appreciate it. But don't forget that you can watch this discussion and past Eye on Health segments on the CBS News Texas YouTube channel.